So one of the things as techs that you might notice is that therapists are often telling you, do it this way or do it that way. Here's a new exercise. Please make sure that this patient knows this one. If it's something that's different, as in opposite of what you've been told before, you need to ask the therapist that. And at the same time, not at the same time, same day, you need to shoot me an email that says, Sarah wants me to instruct bridging like such and such. And the reason for that is because we're trying to keep everything uniform within the company. Certainly, there are patients who need different things with different exercises, and we'll talk a little bit about that with the next exercise, the wall sit. But really, the idea is that we want to be having such a great product, and all of us are at the same level, which means sometimes you guys are getting better training right now, as in more time spent with me actually doing the videos, that the therapists aren't necessarily getting, which means if they're telling you something different, you might think that they're telling you the right way, when in fact, they're telling you to do something that's not correct. So, that being said, that's why I want an email for when you have somebody who's telling you to do it differently. All right? Next exercise, wall sits. So wall sits, we can't have him just put his back up against the wall, please do, and sit down with the legs, right? Sit down, good. Problem with that is couple-fold. His knees aren't tracking appropriately, his back is just flat against the wall, and really what we want to do is make this a little bit more challenging than just being on the table or just being on the wall. So, why don't you come to the side? Which side do you want to do? That's great. I'll take the ball, thank you. Drop it. Thank you. Okay, so what we're going to do is take the lumbar spine. Is it on still?
Yeah.
What we want to do is take the lumbar spine and actually put it up against the ball. If we do that, you'll notice that his feet are basically right underneath him. And if he squats down, what happens to his knees? We've got this really big angle where his kneecap is actually in front of his toes. Now, it's not the end of the world that that happens, but we just don't want to train our patients with that. So what we'd like him to do is when he starts, the patient position is going to be with his feet maybe a foot forward. And we want his feet, give or take a shoulder width or hip width apart. From there now, you'll see he's leaning backwards. And what we want to do is create basically a hook lying position, but upright. So hook lying position would be with his knees bent, there you go, like so. So he basically looks like he's lying on the table, right? Because we want to get his lumbopelvic area to stabilize while his pelvic femoral area rotates only, and then he stabilizes there. So as he's doing this, let's look at a couple different things. The reason I have the stick here is his trunk actually vertical or is it leaning backwards? And you'll notice ever so slightly he's leaning backwards at his trunk. So we don't want him to bring his chest forward, because that's going to mean that bring your chest forward and drop. He's just going to drop down and he's going to roll. Instead of doing that, what should we do? Have him bring his buns backwards. So bring your buns backwards a little bit more. There you go. And then patients will say, well, that doesn't feel right. But then you can bring over one of the mirrors and you can show them you are actually straight up and down, even though it doesn't feel the right way. The importance of this is to teach them the proprioceptive awareness, not just how it's always felt before. Then he comes back up. Now, what we haven't done yet is do the hook lying position with the brace, right? Because this is bracing and bridging put together in upright. So, we want to tell them this. Corey, what we really want you to do is take your abdomen and brace, just like we did on the table, but now we're upright. So can you think you can do that? Not bad, good. How about right down there, can you get that on? Awesome, great. Now let's get into that downward position. Keep your buns going backwards, buns go backwards. There you go, just like that. Perfect, hold right there. And this should feel like your hamstrings are working. Uh-oh, your hamstrings aren't even on. Come back up. So here's the problem. People always get their quads going, because when you think squat, what do you think of? Quads, right? That's the only thing you think of. So what we really want to think about is this, that the hamstring is activating and drawing the buttocks downwards and then contracting and bringing the buttocks up. So here we go. Activate here. You know what, here's the problem. You're leaning backwards already. There you go. Bring your buns backwards a little. There you go. Activate right through here. Even more. Good. Now drop yourself down so that you're thinking about doing the bridge that we did on the table. There you go. Activate right here. Activate here. Yeah, that's it. Let your buns go back. Activate. Activate. Nice. Now how does that feel?
I don't even feel it my quads.
Now I don't even feel it. No, they're working. They're working otherwise he would hit the ground. But really what we're activating here is the co-contraction of the hamstrings and the quads simultaneously. This is so important because, again, most of our patients who are quad dominant, they've got this anterior hip pain with low back pain. Their problem is that their hamstrings don't know how to activate. Press yourself back up. Oh, very nice. Okay, you can step aside. Zoe, come on up. So, it's okay, shoes can stay on for this one. So, from what we saw Zoe do on the table, we would expect her to do a little bit of the rounding, right? And her rib cage is going to be lifted up while the rest of her is doing something completely different. So this is what we want to watch when she does this. All right. So bring your feet a little bit further. There we go. She's also leaning backwards, so let's get her to be straight up and down. There you go. Can you activate hamstrings? Activate your core. Where's that rib? Lovely. So far, so good. Now can we move? This is the hard part. I don't think I can. Right? Good. There you go. Bring the knees forward. That's it. Freeze right there. She's already starting to shake, right? So I don't want her to go down to 90 degrees, right? I want her to stay where she's just barely getting the muscle activation correct, and then she can build it from there, right? Now, if she's still not doing this well, stay there. If she's still not doing this well and she's still trying to tuck her buns underneath, what do we do during the bridge to make sure that they elongated their trunk? She can push her knees forward. If she does that, what happens? Nothing. Or we can put the hands on the butt bone, right? This is your sit bone. Can you push into my finger at the sit bone? There you go. And that brings it backwards so that she's now in line. Then she pushes back up. And then when your patients start complaining and going, oh, my legs hurt so much, you say, and this is why we have to train your legs. So do you see how long these muscles are? They're like 2 feet long. Your little back muscles are about that long. Which one do you think is going to be better for taking your body weight? Of course, your legs. So they're supposed to work like that. They're supposed to feel like a burn. So if you feel a burn, we are right on. Okay, here we go again. And then you carry on, right? Excellent.
So with this one, like what's a good, like if they really are all about like, I can't get my hamstrings on, I really can't get my hamstrings on.
Then you say, great, so hold on one second. Let's take the ball down. Lie on the ground, please. So I know that you did the bridge before and you did it perfectly. Let's get your brain to connect to your hamstrings again because they're there. You're not noticing them. So core activation. There you go. And slowly push your feet down into the ground. And as you push your feet, do you feel your hamstrings there? Sorry, you're ticklish. Okay, you feel it a little bit?
I feel it.
Not really. Okay, hold on. It'll get better. So squeeze again. Push your feet down into the ground. Good. Now elevate the buns by pushing your feet down really hard. Even more, even more, even more. There you go. Now, focus on the back side here. Do you feel that now?
I feel it right in there.
Perfect.
Yeah.
That's your hamstring, and that's what you want to feel when you're standing up. Okay? Great. Now let's go back to standing. That's how you do it. Okay? Take it back to where you know they were successful already. Great. Now, here's what happens. So people get hamstring cramps, right? Is this good or bad?
Good.
It's good. Why is it good?
It's working.
It means it's finally working, right? And here's what everybody does. Everybody stretches their hamstrings, right? Stretch, 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 which she's trying to do right now. The better thing to do when you get a hamstring cramp is to shorten it. Because the reason it's cramping is that it's trying to learn how to work in a shortened range, right? So this is a lengthened range. This is a shortened range. So if you help it to learn how to fold on itself and create a contraction, then you're going to be much more successful when they're up about trying to do squats and trying to activate their hamstring while they're doing gait or jumping or whatever it is that they're trying to do. Okay?
So tell them to shorten the hamstring.
Tell them to shorten it. And tell them it will feel like a knife stabbing you in the leg. And then you can make fun of them and be like, really? You've had a knife stabbed in the leg before? But no, so that's the idea. Okay? Other questions?